Before I get started, I wanted to thank a couple of people. Number one, I want to thank the Lupus Foundation. What an amazing organization, the teamwork. Let's get a hand for them, please. It's an absolutely amazing organization. They're very aggressive. They're really advocating for their patients, and they do such an amazing job. They educate, they empower you guys. Fantastic. The second person I'd like to thank is Dr. Don Thomas. He's a friend, he's a mentor. I consider him one of the lupus experts in this region, and he's absolutely fantastic. And his leadership for the Lupus Foundation is well-deserved. Thank you, sir. And the last person I want to thank is my wife, my beautiful wife, Mona, who she gave me some free time because we have two little ones running around. I have a 18-month-old and a three and a half-year-old, and so I need a little time to work on the talk, so she was doing double coverage there. And she's also a rheumatologist and at Innova Fairfax, and so she made sure my facts are straight because I'm a cardiologist. I'm like, what am I doing here? So thank you again, Mona. And here we go. So I know you guys know lupus. You probably know lupus better than me, but I just wanted to just start with a brief overview, and then we'll get to the meat of the matter. As you guys know, it's a chronic autoimmune disorder. It can affect almost any organ. What happens in lupus, as you know, is these attacking autoantibodies start ravaging different organ groups. And it's quite prevalent. 1.5 million Americans are affected, and most of those are younger women. 90% are young childbearing women. There's an ethnic disproportionate effectiveness. Specifically, African Americans are 3 times more commonly affected than Caucasians. Asians and Hispanics are twice as more commonly affected. And the problem with lupus is it's very difficult to diagnose. 1, it affects almost all the different organ systems. 2, it can flare up and then become quiet or have remission phases, and so sometimes it's hard to catch. And finally, it can also, the way it presents, you can mimic many different kind of disorders. And so again, that's why we need a multidisciplinary approach to treat this condition. And that's why things like yoga, tai chi, all the different subspecialties like it's cardiology, nephrology, pulmonology, everyone is all on board together to help treat this condition. So how can lupus manifest in the body? We know it affects the joints. We know it can cause this butterfly or malar skin rash on your face. It can have those discoid lesions or disc-like lesions on your skin. It can make you feel overall crummy. What do I mean by that? I mean like a weakness, a malaise, a sort of a fever type of appearance sometimes. You can lose your hair. It can affect the brain. It can something called lupus cerebritis, which is inflammation of the brain. We know it can affect the fingers, Raynaud's phenomenon, this cold-induced vasospasms of your digits, which are turned blue and white. And one of the worst things that can happen from lupus is, unfortunately, the kidney disease. It can cause this glomerulonephritis. What that means is basically the autoantibodies are attacking the filtering mechanisms in your kidneys. But we're going to focus today on cardiac manifestations, the heart manifestations of lupus. So I was thinking about how to prepare for this talk, and a couple of thoughts came into my mind. One was like, let me just take a step back and maybe just go through a little bit of anatomy. I mean, I am at the medical school auditorium at Johns Hopkins, so I thought, a little bit of basic anatomy may be helpful. But then I'm like, what book should I use? Should I use Gray's Anatomy? And I'm not talking about the show. This is the original textbook used to teach medical school students. But then I thought about another doctor, a doctor that was very dear to me when I was growing up. And so I thought about Dr. Seuss and how he keeps it very simple. And he says that a true master can explain very complex thoughts into very simple ideas. And so that's what our goal is today. So this is actually my son's book he got from the library. Okay. So let's talk about pump function. We know a heart serves many roles, but one of the main things, it's the pump. Some of the statistics are it can circulate 5 to 6 gallons of blood each minute throughout the entire body. The heart also comes in different layers. What do I mean by that? I mean there's an outer layer of your heart called the pericardium. There's a thick muscular layer that actually squeezes called the myocardium. And then there's a thin inner lining called the endocardium. Now, I may be losing some people because I see some dazed faces. So again, back to the Dr. Seuss principle. Keep it simple. A pericardium is like the chocolate on the outside of a strawberry, so the outer layer. The myocardium is like the thick, fleshy part of the strawberry, and the endocardium is the inner portion of the strawberry where the valves are. Speaking of the valves, there's 4 major valves in the heart. We know there's the pulmonic valve, the tricuspid valve, the aortic valve, and the mitral valve. The reason why the mitral valve is in red is because this is the valve that's most affected in lupus patients. And before I go on to the next slide, let me take one step back. So the heart has 4 chambers, and the valves, what they do is they allow blood to enter from one chamber to another. And so that's the function of these valves. Let's go on to the next topic, electricity. So your heart, again, has many different functions. One of them is electricity. It generates electrical signals from the top chamber of the heart in something called the sinus node and delivers it to the rest of the heart to allow the heart to squeeze, for the muscles to squeeze. And in lupus, again, some of the conduction system or electrical systems can be affected. And finally, we're moving on to the plumbing. So this is not like a advertisement for Home Depot. Really, your heart is taking care of all these different functions. But the plumbing is really the coronary vessels. These are, you are born with 3 vessels of the heart. You have the right coronary artery, you have the left circumflex artery, and you have the one that flows on the very top, the left anterior descending artery. This is one of the most serious complications of lupus, where you have blockages or atherosclerosis and plaques, and this can lead to heart attacks. So now that you guys have this background, let's move on. Let's talk about the actual manifestations or problems that occur, or the damages that occur with lupus. You got the pericarditis. We talked about that. Remember, it's the outer layer of the heart that can be inflamed. Then you got the endocardium, and part of the endocardium is the valves, and we talked about how certain valves are more affected in lupus. Finally, you have the plumbing issue or coronary artery disease. Then you have the myocardium or myocarditis. That's where your pump can go kaput, and basically your function decreases dramatically. And finally, the conduction abnormalities. This is an electrical system that delivers electricity throughout your heart, and that can also be affected in lupus. So moving on to our first topic, pericarditis and lupus. So this is one of the most common manifestations in lupus. And in fact, not only do you get inflammation around the heart, but sometimes you get a small, thin layer of fluid that circulates around the heart as well. And most of the time, it's not a big deal. The patients are not necessarily symptomatic, and you can sort of treat it conservatively. But sometimes it can get a lot worse, and we'll talk about that on our next slide. But one of the interesting things about pericarditis is it's very symptomatic. Patients have this particular type of chest pain, and it's positional chest pain. It's chest pain that's worse when you lay down, and when you lean forward, it improves. And the reason for that is the heart fills a lot more, or left ventricular filling is a lot increased when you're laying down. But when you lean forward, there's a little bit less left ventricular filling, and so there's a little bit more space between the pericardium and then the heart. Another reason is also gravity helps to sort of stretch the pericardium out, and again, creates less friction rub. So I talked to you about that fluid around the heart. This is an ultrasound of your heart, also known as an echocardiogram. An echocardiogram is a tool cardiologists use quite frequently to help have a window or have an image of what your heart looks like. And you can see here, this is your left ventricle, one of your main pumping chambers of your heart. And this should not be here. This arrow is indicating this wall of fluid around the heart. So what are the treatments for pericarditis? One of the common things is something everyone has in their cabinets at home, and that's NSAIDs. NSAIDs are non-steroidal anti-inflammatory agents. What's an example of that? That'd be the Motrins, the Advils out there. If you're like a clinician, sometimes you prefer something a little more stronger, such as indomethacin. This is usually the first line treatment, and you treat them for about 4 to 6 weeks sometimes. Now, if this works, great. Now, if it doesn't work, the second line agent, and I think literature is more leaning toward this now, and it's actually a gout medication. It's called colchicine. Colchicine is used in gout, but it's found to be very effective in recurrent pericarditis, or pericarditis that occurs after being treated initially. There's always, obviously, the last choice, which is steroids. Now, steroids is a great agent. The problem with that is there's the chance of recurrence with steroids after you decrease the flare. Now, what are the complications of having this significant pericarditis, and mostly, what are the complications of having that wall of fluid I talked about that can surround the heart? Well, it can accumulate to such a point to where it actually collapses your heart, and your blood pressure drops dramatically, and this is actually a hemodynamic emergency, and that's called tamponade. And some of the tools and techniques we have are it's not very fun, but you can stick a needle into that pericardial space and drain it out. And that sometimes can be done in an emergent setting or more of a planned setting. Also, surgeons can get involved and create a window, a thoracotomy window, and put a chest tube in there and drain it out if there's a significant amount of fluid. So that's the first topic we talked about, pericarditis as one of the main complications of lupus. Let's move on to our second topic. It's lupus and valve disease. Again, as you remember, we're talking about the heart in layers, and this is that inner layer of the heart called the endocardium that's being affected. So lupus can cause valve vegetations to occur, resulting in regurgitation. What does that mean? That means that lupus can form deposits, these nodular lesions on the actual valve. It damages the valve, it can cause fibrosis, and then it can cause healing, and then that damage can cause the valve not to close properly. A valve normally works as you think about in even hardware, or a valve opens and closes. Now, in the heart, if it doesn't close properly, blood can leak back into the previous chamber, and that's the fancy word we call that is regurgitation. What is a murmur? You've heard people throw that term around. Murmur is just an abnormal flow sound. Now, murmurs can be from problems such as regurgitation, or they can be from things that can happen in lupus, as we know. Tachycardia, which is fast heart rates, anemia due to low blood counts, fevers. That can all cause increased flow around the heart, and they create these artificial sounds as well. Again, I told you the culprit lesion, or the valve that's most hit hard in lupus, is the mitral valve. It's not clear exactly why, but that's the most common valve affected. And thankfully, stenosis, or narrowing or tightness of the valve, is not happening in lupus patients. And the way I think about stenosis is if you had a garden hose and you're like spraying water, you put your thumb over the garden hose, that's stenosis, that's narrowing of that opening, and so very little is coming out. But that does not happen in lupus. So what happens if you're a lupus patient and you have valve disease? What should you be concerned about? 1 in 4 patients has a risk of stroke, blood clot in the lungs, congestive heart failure, endocarditis, and even death. So again, having valve disease in lupus is a concern, and you have to be aware. So Dr. Libman and Benjamin Sachs were 2 doctors who practiced in Mount Sinai in New York City in the 1920s. They started noticing something. I don't know if they were cardiologists or internal medicine doctors, but they've noticed that when they were looking at certain lupus patients and they're looking on ultrasound, that there's these large wart-like lesions, and you can see it up there. They were seeing these on their patients, and they were one of the first to describe this thing called verrucous lesions, or extreme endocarditis. And Libman Sachs endocarditis is named after them. The main thing is these are non-infectious lesions on the valves. And I guess I mentioned to you how they form. You have immune deposits and scarring and fibrosis and abnormal healing, and they become calcified, and this is what they look like. And the problem with this is a great place for bacteria to go hang out and eventually become super infected. So initially, as I mentioned to you, this is a non-infectious endocarditis, or inflammation of the endocardium on the valves. But then the environment is so rich for the bacteria that they just jump right in and cause much more destruction. The second picture I wanted to show you is really This is, again, ultrasound of the heart, echocardiogram, and we have the left ventricle here and the left atrium. And again, we know that valves separate two chambers. And this, again, is that unfortunate mitral valve, and look at that big whopper right there. So that's an example of endocarditis. So thankfully, due to aggressive treatment by rheumatologists and other physicians, Liebman sacs is quite not as common as it used to be. And a lot of times, people are asymptomatic. We may find these lesions incidentally when we get an echocardiogram on patients, but they don't have the typical symptoms. The other interesting thing is if you have these autoantibodies. Now, lupus patients have several different autoantibodies, but I'm going to just focus on two groups. The antiphospholipid antibodies, if you have that antibody, you're at 3 to 4 times the increased risk of having this kind of endocarditis. And if you have lupus anticoagulant, you're 6 times more likely to have these lesions. So again, just more awareness will lead to more vigilance in this condition. So how do we diagnose this? Again, a good set of ears on a good clinician with a good stethoscope should be able to help pick some of this up. Also echocardiograms. And if you suspect fevers or if they're starting to look not right, you may want to consider getting blood cultures. Now, echoes come in 2 flavors. Again, echoes, as I mentioned to you, are the ultrasound that cardiologists and other doctors use to diagnose different things. And there's the transthoracic echo. That's just sort of a regular everyday echo. It happens in the doctor's offices or in the hospital. But then there's a fancier echo. This is like your Samsung 70-inch TV with 3D capability. That's your transesophageal echo. It's like similar to what the GI doctors use to check for ulcers on an EGD. And there's an ultrasound probe on that, and it provides crisp, detailed pictures. So sometimes on the regular echo, you may miss the lesions, but on the transesophageal echo, you're able to pick it up. So sometimes we have to use different tools. Moving on to prevention of this kind of endocarditis. So the guidelines sort of for endocarditis not involving lupus is pretty clear, but now I wanted to add a little spin on it and try to talk about how lupus patients with endocarditis, should I get antibiotics or should I not? And so I think the common consensus right now seems to be if you're an immunosuppressed lupus patient, meaning your immune system is low due to the different kind of medications you're on, and you're going for any kind of considerable dental procedure, yes, you should get antibiotics before that, and that should help prevent some of these endocarditis lesions. Now, what happens when you already have these lesions on your valves? One of the devastating complications from these lesions is stroke, and you might want to be on blood thinners such as Coumadin, aspirin, or you may need a bridge to get to those therapeutic levels with either heparin or Lovenox. Now, if the valve is already damaged, there's 2 options, a valve repair or either a valve replacement. So moving on, coronary artery disease and lupus. Again, this is, I would say, the centerpiece of my talk. This is the thing that we can make huge progress in. Coronary artery disease is overall prevalent in the American population, but then throw in lupus and it just takes it to a different level. So unfortunately, women with lupus have a 55-fold increased risk of having coronary artery disease. Specifically, they've done some studies on young lupus patients who've died for other reasons, and they've done autopsy studies, and they've looked at their coronary arteries, and almost 50% of them had significant atherosclerosis on their coronaries. Atherosclerosis, again, is the cholesterol buildup in the coronaries. And not only are we worried about atherosclerosis, but the resulting complications. We can have lupus patients having a much higher risk of heart attack, stroke, peripheral arterial disease, which I want to explain is disease in your carotid arteries, which are your neck arteries, and your leg arteries. And this is compared to the average population. So we know lupus is an inflammatory condition. I mean, that's sort of the bread and butter of lupus. But the current consensus is really even heart disease is an inflammatory condition. And what do you get when you mix 2 inflammatory conditions together? A lot of trouble. So there's a cascade of inflammatory cytokines, immune cells, and then they form this plaque or cholesterol plaque in the arteries. And this is normal without lupus. Now, when you add in lupus, this accelerates the process and also makes the appearance of these plaques even occur prematurely. So this is just a simple cartoon outlining how you're born with nice, clean, normal vessels, and over time they can get this buildup, this cholesterol inflammatory plaque, which can one day eventually rupture, and that's what usually causes the heart attack. So how do we identify these kind of these risk factors in non-lupus patients, and what are the risk factors in lupus patients? So let's focus on the non-lupus patients, or these are also known as traditional heart disease risk factors. In men, it's age, for example. In men, it's age greater than 45, women greater than 55. We know a family history. We know if you have a history of diabetes, if you're obese, if you're sedentary, if you have various different cholesterol problems. All these things, if you're a smoker, all these things cause heart disease. We know that. The interesting thing is there's special risk factors in lupus patients. Just by having lupus, there are certain things that, and in steroid use, you have an early risk of developing hypertension. You have an early risk for developing diabetes, obesity. You can have premature menopause. You can have and because of the joint pains and other issues, you can have sedentary lifestyle. If you have flares, you may be on steroids. Elevated CRP, this is a biomarker that has been known to have affiliation with damage to the blood vessels. You can have the fact that you have lupus, you can have lupus flares, and that can indicate higher disease activity, which can again cause more atherosclerosis and more heart disease. Again, I told you, of all the different manifestations of lupus, kidney disease is one of the worst, and it has multiple effects on the body, and specifically one of the concerning ones is it can accelerate heart problems as well. Complements, autoantibodies, antibodies to double-stranded DNA, antiphospholipid, as I mentioned before. So I keep on sort of banging up on steroids, or I keep giving it a bad name, but why is that? Because I know steroids help. I know it can cause remission, and it can cause decrease in the flares, but there's a dark side to steroids. So I'm going to focus on the heart part right now. Steroids can, again, cause or worsen cholesterol. It can cause or worsen diabetes, obesity, and even hypertension. And the fact that you're actually on steroids tells me something. It tells me that you have a very active lupus condition or active lupus inflammation. All these things, again, have more of a negative consequences in the heart. And these are all the different things that can happen with patients on steroids. A lot of different other conditions, but I'm just going to focus on the heart conditions right now. So I was trying to figure out how to tie it all together. And so first, we talked about the traditional risk factors and how that can cause heart disease. Then we talked about how lupus by itself either can cause heart disease or on additive to traditional risk factors can cause heart disease. And finally, there's all these other lupus risk factors that can cause heart disease. And thrown on top of that, you got the steroid use, and all that does is cause accelerated, premature, aggressive cardiovascular disease. So again, we have to be very vigilant. We have to monitor risk factors. We have to be careful, and we have to treat aggressively. So here's some of the statistics in terms of decades of life and how that can cause atherosclerosis. So this is from the New England Journal of Medicine, where they did some studies, and they showed that compared to normal populations, lupus patients developed a significant amount of plaque. For example, in the 4th decade of life, only about 2% of the normal population had some plaque formation, while 13% of lupus patients have plaque formation. Let's fast forward to the 6th decade of life. So when you're in your 60s, boom, look at this. 30% of normal patients have some kind of cholesterol blockages, while 70% of lupus patients have cholesterol blockages. That statistic alone should really hit it home. So let's talk about lupus and mortality. So after the lupus diagnosis, within 3 to 5 years, there is a spike in patients having poor outcomes. And that's usually due to either a very active lupus condition, either complications from their lupus, or again, the kidney damage, the glomerulonephritis from the lupus. then most patients do well for a period of time, and then there's another spike in mortality, unfortunately, around 15 to 20 years after diagnosis. This is first described by Dr. Urowitz in 1976. So when should you guys get evaluated, or when should patients with lupus get evaluated? Well, we know if you have chest pain or pressure, that's a warning sign. If you have shortness of breath, another warning sign. Now, if you're short of breath, if you're not short of breath, rest, but when you push yourself, you get short of breath, that's called shortness of breath with exertion, again, concerning. Let's say you're usually able to walk 2 blocks, and then over to the last 6 months, you notice you can only do a block or maybe half a block. That's concerning. That's decreased exercise tolerance. If you have pain radiating to your jaw, your back, your arms, again, a warning sign, a red flag should go up. If you have chronic heartburn or indigestion, this is another concern. There are also concerns for the fact that a lot of people are asymptomatic, meaning they have 0 symptoms. So for those patients, I would say if you have lupus or a very active lupus and you have either 2 or more traditional risk factors, you should at least go talk to your doctor and possibly get more evaluated. So what kind of tests do we have? What tests do we have in our toolbox to help with lupus patients and heart disease? Numerous testings we have. We have the EKGs, which look at electrical activity, and it's like an electrical overview of your heart conduction. We have the echocardiogram, which I mentioned to you is the ultrasound. It's a peek inside your heart and look at your function, your valves, and also possible fluid around the heart. You have your CT of the chest or CT of the coronaries. You have a chest x-ray, looks at the size of your heart. Nuclear stress tests look for blockages that are significant, and you have cardiac caths or cardiac angiograms that can look for blockages, and if there's a blockage that's significant, they can treat it at the same time with stents. So there's lot of imaging studies on lupus patients, and one of them describes almost 50% of patients, or 50% of women with lupus who have symptoms. If they went for a nuclear stress test, many of them would have abnormal stress tests. And another study in the New England Journal that we were researching showed 1/3 of all lupus patients who had coronary CT scans, where they're looking at calcium scores, they had significant calcified coronaries compared to only 10% of the regular population. So I'm sort of, talking about all the, gloom and doom right now, and I want to show a ray of light here. So again, you guys are a lot stronger than your condition. You guys are much more powerful than lupus, and lupus is something that you guys can treat, be aggressive about, and here's some strategies to prevent heart disease. So 1, if you smoke, please stop. There's absolutely no reason to continue smoking. It accelerates a lot of different negative pathways. The type of diet that I'd recommend is probably a Mediterranean diet. It's been tested by numerous different associations, including the American Heart Association, the American College of Cardiology. Very good diet, very reasonable to follow, and quite a lot of variety to eat. You want to reduce your cholesterol. You want to lower your blood pressure. Physical activity. We need to get more active, at least 20 minutes a day, at least most days of the week. Start with 3 times a week and move on up after that. You want to maintain a healthy weight. That's a body mass index of about 25 or less. You want to reverse and prevent diabetes. And again, diabetes is reversible and is preventable. You want to limit stress. Stress causes a stress hormone called cortisol to be ramped up, which is an inflammatory type of process, and you want to reduce that. So again, if you already have heart disease, what do? Well, I talked about the lifestyle modifications. That can help really work on your heart disease. But there are also other medications. Statins are considered to be anti-inflammatory, anti-thrombotic, and they help stabilize plaque. There's a little bit of differing information on statins in the lupus literature, but I still think it's probably recommended right now. Another thing is hydroxychloroquine. So let's get a hand of people who, anyone here take Plaquenil? Let's get a shout out to Plaquenil. All right. So it's a very good drug, and apparently there's much more much more benefits than just the lupus remission type of benefits. It's anti-inflammatory, as we know, but it's anti-thrombotic, there's anti-lipid benefits, there's even diabetic benefits. So very good medication, and it helps get you off of steroids. So definitely highly recommended. Hypertension. If you have hypertension, and you happen to have some of the other conditions that come with lupus, such as Raynaud's, you may want to consider calcium channel blockers. That's a class of medications, and one of the most typical examples is nifedipine. If you have kidney disease and you have hypertension, you may want to consider a class of medications called ACE inhibitors, because they can help prevent the progression of kidney disease. Again, I've harped on this before, but try to minimize your steroid use or decrease the duration that you're on it. So God forbid you actually have heart disease and you're at the point where you need help. That's where you see cardiologist, and a cardiologist can provide a couple of different things. They can do an angiogram, which is a heart catheterization where they look at your actual blood vessels on the inside, and they inject a contrast dye and it flows through. And again, as you remember, you have 3 main coronary arteries, and if there's a blockage, and we consider a blockage anything maybe 75% or higher, then you may want to get treated with a stent. A stent is like, imagine you take a ballpoint pen, you unscrew it, and that little spring in the ballpoint pen, that's like a stent. And we take that into the artery and we expand that and sort of crush the plaque, the clot, and make an open pathway for your blood to flow again. And if you have too many blockages, there's a blockage on almost all of your vessels, or there's significant blockages and you're diabetic, then the choice is really coronary artery bypass grafting. So the way I describe that to a lot of my patients is, imagine if you're trying to get into Baltimore, there's an accident, you take the alternative route and you go around it, and you get into Baltimore after the accident. And so that's the same thing we do here. There's a blockage in your heart artery. We take a vein from your leg and we sew it on before and after the blockage, and then you bypass the blockage. So this is the 4th disease state that lupus affects, is lupus and myocarditis. This is a thick muscle tissue that's inside the heart, also known as the myocardium. It can get inflamed, and eventually it can decrease the pump function of your heart. Normal pump function, we use that term as cardiologists, we use the term ejection fraction. I also call it horsepower of the heart. The normal horsepower of a heart is about 55 to 60%. And if you have myocarditis, that can drop down to almost 5 to 10%. And it's very dramatic, and it happens over a very short period of time. Thankfully, this is not very common. Only 6 to 8% of lupus patients have it currently. How do you present? Sometimes you have a tachycardia you can't explain. A tachycardia is just a very fast heart rate. Sometimes you have conduction abnormalities, or your electricity is not flowing properly. You have an abnormal EKG. On chest x-ray, you have a very enlarged heart. Sometimes you have heart failure, which presents as shortness of breath, flooding or fluid in your legs, fluid in your lungs. Now, when you have all this, how do we diagnose this? Well, again, this is quite rare, but in the case that this is a patient does present with this, we'd want to probably consider getting a cardiac MRI, maybe do a cardiac biopsy, which is taking a sample of that muscle tissue and looking under the microscope and seeing what's going on. There are certain antibodies such as RNP, or ribonucleic protein, that can be tested in the blood. You want to treat with steroids. You want to treat with very good heart failure medications, and possibly even IVIG. So this is the last topic on lupus and lupus and heart disease, and this is the electrical system I talked about, the conduction abnormalities. Anywhere between a third to over 3/4 of patients have some kind of conduction abnormalities, especially if they've had that myocarditis in the past. First degree AV block is one of the most common things. All that means is on the EKG, there's a particular type of pattern we see. And what it means is the electricity that normally runs from the top part of the heart to the bottom part of the heart, there's a slight delay from going from the top to the bottom. And another concerning thing is ventricular tachycardia. And this can happen because there's something called a prolonged QT that can happen when you have anti-Rho antibodies circulating, and that can damage your conduction system. In lupus moms, there's a special condition, and this is called congenital heart block. So this is part of a neonatal lupus syndrome, and mothers who have lupus, or pregnant women with lupus, have anti-Rho anti-Ro, anti-LA antibodies, and they can cross into the placenta and damage the actual conduction system of the fetus. And so what we recommend is screening of moms prior to screening of women who plan to get pregnant, number one. But if you already are pregnant, then in the beginning at week 16, you want to get some kind of screening done. So this would help prevent these kind of congenital heart blocks in the children. So before I move on to just opening the floor to questions, I just wanted to try to anticipate what kind of questions you might have, and I had some frequently asked questions here. So I've had a lot of lupus patients ask me, what kind of tests can be done to determine if I have lupus or if it's affecting my heart? Well, I talked about it. Based on your history, symptoms, and risk factors, you may want to consider getting an EKG, an echo, a chest x-ray, stress test, possibly a lipid panel, and if need be, in worst case scenario, you may need a heart catheterization. So some patient has asked me, can lupus cause something called pulmonary hypertension, and can it be prevented? So my answer to that is yes, lupus can cause pulmonary hypertension, but pure lupus by itself, it's quite rare. Now, lupus can occur in other forms, such as in something called mixed connective tissue disorders, or scleroderma, and overlap disease with lupus, and this can have a lupus-like presentation, which can cause pulmonary hypertension. And you may be wondering, what in the heck is pulmonary hypertension? That's just high pressures in the lungs, and it can be caused by numerous things. But the great thing is we can assess it, we can diagnose it, and we can treat it. My doctor told me I have pleurisy or pleuritis, and I have chest pain. How do I know it's not angina? Well, it's more of the characteristic of the pain. As you guys know, pleuritis is sharp jabbing pain, and that's like the inflammation of the lung lining. And it's worse with deep breaths, while more of an anginal chest pain or blockage type of chest pain is a squeezing pain, worse with exertion or stress, and sometimes improved with a medication called nitroglycerin. And a lot of people describe the whole elephant on the chest type of feeling. Can lupus elevate your cholesterol levels? Yes, it can cause increase in your LDL, it can decrease your HDL. I have antiphospholipid antibodies. What cardiovascular issues am I facing? So we know antiphospholipid antibodies increase your risk for thrombosis or increase your risk for forming clots. And here's the kind of patients who would be at higher risk for forming clots. If you're a smoker, if you have kidney disease, if you're on birth control, or if you have a high cholesterol, again, all predispose you to higher risk for clot formation. And then remember, antiphospholipid antibodies also increase your risk for vegetations on your heart valves. And finally, the last question I get asked sometimes is, how do I, as a lupus patient, with all my flares, with all my joint issues, with all my different things going on, start a healthy diet, a nutrition, or an exercise plan? So I usually say, that's a great question, and here's my answer. I want you to start some kind of low impact. Well, first is just get started to do something, because again, I emphasize again, you're much stronger than your condition. Low impact exercises, such as when we've seen it here today, flexibility exercises, yoga, Pilates, Tai Chi, all probably decrease inflammation. Cardio exercise such as water aerobics, and walking or elliptical or biking within reason is, I think, very good. Light resistance training with bands. You could try changing some of your diet, low inflammation diet, possibly eliminating different allergens such as gluten and dairy, adopting more of a plant-based or vegetarian type of diet, maybe increasing your water intake, trying some detoxification techniques such as green smoothies and fresh juices, probiotics. Plenty of rest, 6 to 8 hours of sleep. Again, you don't want to have an inflammatory mindset, so again, have a positive mental attitude. And across the country, there's a new type of medicine starting to be practiced along with traditional medicine that's called integrative functional medicine. And they've made great inroads in conditions such as cancer, and now they're starting to tackle some of the autoimmune issues. And they've suggested such as massage, acupuncture, mind-body relaxation, and guided imagery have all found some benefit in lupus patients. So my takeaway points. Again, we know lupus affects the heart in three main ways. It affects your three layers we talked about, the pericardium, the myocardium, and endocardium. We know it affects your plumbing, causing coronary heart disease. We know it affects your electrical system, causing conduction system issues. We know lupus causes this accelerated premature heart disease, and we have to be very careful about that. We want to decrease the duration and the amount of steroids we take. And finally, our primary docs, our rheumatologists, and patients must all be vigilant and assess risk factors and modify lifestyle. So my goal really is let's cool down the inflammation of our hearts and have a strong, vibrant body. Thank you. Okay.